Welcome to Bloodborne Pathogens, an e-learning course by McNeil & Company. This course is based on 29 CFR 1910.1030, OSHA's Federal Standard on Bloodborne Pathogens. The standard lays out guidelines and requirements for all employers and employees when there is a possibility of being exposed to blood in the workplace. For this course, your business's exposure control plan should be available to you, and the plan should always be easily accessible to employees. These plans identify jobs and tasks in your workplace where exposure to blood or other potentially infectious material may occur. Exposure control plans should be reviewed at least annually and whenever new or modified tasks or procedures involving bloodborne pathogens are put into place. Additionally, should you have any questions during the course, you should reach out to your employer to ensure that you are certain of the policies and procedures that you should follow. By the end of this course, the student will be able to define bloodborne pathogens, occupational exposure, and other potentially infectious materials. By the end of the lesson, students will understand who is covered by the bloodborne pathogen standard and be able to describe epidemiology and symptoms and modes of transmission of bloodborne diseases. Students will be able to recognize tasks that may involve bloodborne pathogens and identify exposure prevention steps, including engineering controls, workplace practice controls, and personal protective equipment. Lastly, the employee must know what to do and what steps to take in the event of an exposure. According to OSHA, bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, HBV and HIV. Microorganisms and disease in humans can also be spread by other potentially infectious materials, or OPIM. Many bodily fluids, including blood and even saliva, may have bloodborne diseases. Additionally, organs and tissues are considered OPIM. Occupational exposure is reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. These employees may include, but are not limited to, firefighters, EMTs, emergency response teams, doctors, nurses, blood cleanup specialists, tattoo artists, and even those who clean and wash laundry, as the laundry could be contaminated. A Good Samaritan act, such as helping a coworker with a paper cut, may not necessarily be considered occupational exposure. Bloodborne diseases are dangerous and can have severe health consequences, including death. Students must know the epidemiology and symptoms of bloodborne diseases to have an understanding of their danger and to recognize symptoms in the event of an occupational exposure. Human immunodeficiency virus, or HIV, is the virus that causes AIDS, which is chronic and fatal. However, there are treatment options available for HIV. According to HIV.gov, in 40 to 90% of cases, HIV symptoms will present within 2 to 4 weeks of infection. However, in some cases, symptoms may take as many as 10 years to present. When symptoms start to occur, they will present as a severe flu, with weakness, diarrhea, and weight loss. Hepatitis B, or HBV, is a virus that can range in severity from an acute mild illness lasting a few weeks to a chronic and serious lifelong infection. Hepatitis is an inflammation of the liver and, if untreated, can cause cirrhosis or liver cancer. Hepatitis B can survive outside of the body for at least 7 days and can still cause infection if it enters the body of an uninfected person. The symptoms of HBV can be delayed up to 9 months, but when presented will be similar to flu-like symptoms. Fortunately, HBV has a vaccination that can help prevent contracting the virus. The vaccination is typically 3 or 4 shots over a 6-month period. Most children will have this vaccination, however some adults may not. According to the CDC, the vaccination should be considered for those who live with a household member that has HBV, that have a job involving contact with human blood, and for the staff of an institution for the developmentally disabled, among many other situations. These additional situations can be accessed by clicking the link available at the bottom of the screen. For employees that have occupational exposure to bloodborne pathogens, the HBV vaccine must be made available by the employer at no cost to the employee. Hepatitis C is another virus that may be found in blood and other potentially infectious materials. The CDC estimates that 2.7 to 3.9 million people in the U.S. are infected with hepatitis C. The virus attacks the liver, initially causing inflammation that can lead up to cirrhosis or liver cancer. The virus can be chronic and fatal, with 8,000 to 10,000 deaths in the U.S. being the result of the disease annually. To understand how to prevent the transmission of bloodborne pathogens, we must have an understanding of the modes of transmission associated with bloodborne pathogens. Puncture wounds are small wounds, such as needle sticks, that may heal quickly, possibly with very little blood loss. Open wounds, cuts, and broken or damaged skin, such as burns or sores, can also be a route into the body for bloodborne pathogens. Lastly, bloodborne pathogens can be transmitted through the body's mucous membrane, which includes the eyes, nose, and mouth. We must understand when we may be at risk for bloodborne pathogen exposure. Exposure may occur during workplace accidents, while administering first aid, whether to a coworker or a patient, during post-accident cleanup, during routine maintenance and cleanup, and while handling contaminated laundry. There are different methods to prevent bloodborne exposure, including engineering controls, workplace practice controls, and personal protective equipment. These all work together to prevent exposure. Engineering controls are controls that isolate or remove the bloodborne pathogens hazard from the workplace. These can include sharps containers, self-sheathing needles, and safer medical devices. Sharps containers are one of the more common types of engineering controls. These containers should be closable, puncture-resistant, labeled or color-coded, and leak-proof on the sides and bottom. Employees should ensure that these containers are always easily accessible, upright, and not overfilled. When the containers are full, they should be replaced only by those trained to do so in a safe manner. While these are commonly associated with the storage of used needles, it's good to keep in mind that these containers can be used for more than needles. Any sharp object that could be a puncture hazard should be placed in the appropriate sharps container. Workplace practice controls are practices that reduce the possibility of exposure by changing the way a task is performed. These changes are commonly the steps that an employee takes when completing a task. A must-have workplace practice is the use of universal precautions. Universal precautions are an employee behavior that is observed to prevent contact with blood or OPIM. Under circumstances in which differentiation between body fluid types is difficult or impossible, the employee will treat all body fluids as potentially infectious and will use proper precautions and safety to ensure that no contact is made with the fluid. Another workplace practice control that should be observed is prohibiting certain actions when exposed to blood or OPIM. Eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses should all be prohibited when there is a chance of exposure. Another workplace practice control that should be observed is prohibiting certain actions when exposed to blood or OPIM. Eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses should all be prohibited when there is a chance of exposure to blood or OPIM.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great! No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
If a hand washing station is not immediately available for employee use, then the employer must provide antiseptic hand cleanser and clean towels or antiseptic towelettes. The cleanser must be approved for use on skin and approved for use on bloodborne pathogens. If these cleansers or towelettes are used, then hands must be washed with soap and running water as soon as a hand washing station is available. If blankets, towels, and an employee's clothing or any other type of laundry is contaminated, it should be removed as soon as possible and contained in a leak-proof bag or container labeled with a biohazard symbol. While handling contaminated laundry, universal precautions should be taken and personal protective equipment should be used. The laundry should be handled as little as possible, and when laundered, the soiled laundry should be cleaned according to the manufacturer's recommendations using a cleaning agent that inactivates bloodborne pathogens. When cleaning blood or OPIM from equipment or other materials, the Red Cross recommends a 10% cleaning solution, 9 parts water to 1 part bleach, or 1 gallon of water with 1.5 cups of bleach. The blood or OPIM should be covered with a paper towel or rag, and then the disinfectant should be poured onto the rags and allowed to sit for 10 minutes. This allows time for the solution to neutralize the blood. After 10 minutes, the materials should be placed in an appropriate container and pickup and disposal of the material should be arranged. Antiseptic towelettes and wipes that are manufactured for use on equipment and are approved by your organization may also be used in some situations. While these may not be the right choice for larger spills, they may work well for small cleanup. The wipes should be approved for use on bloodborne pathogens to ensure that the blood or OPIM is properly disinfected. Personal protective equipment is specialized clothing or equipment worn by an employee for protection against a hazard, in this case, bloodborne pathogens. Gloves, gowns, laboratory coats, face shields or masks, and eye protection and more all help protect from bloodborne pathogen exposure. One of the most common forms of PPE that is used to protect against bloodborne pathogens are disposable gloves. Gloves should be worn whenever it can be reasonably anticipated that the employee may have hand contact with blood or OPIM and when handling or touching contaminated items or surfaces. Disposable gloves should be replaced as soon as practical when contaminated, torn, punctured, or whenever their ability to function as a barrier is compromised. Disposable gloves must be disposed of after use and never reused. To help protect yourself when removing gloves, the CDC recommends the following steps when taking off gloves. First, grasp the outside of one glove at the top of your wrist, being careful not to touch your bare skin. Peel off the first glove, peeling away from your body and from wrist to fingertips, turning the glove inside out. Hold the glove you just removed in your gloved hand, and then with your ungloved hand, Peel off the second glove by inserting your fingers inside the glove at the top of your wrist. Using your fingers, turn the second glove inside out while tilting it away from your body, leaving the first glove inside the second. Dispose of the gloves safely and then immediately clean your hands. A poster of these steps made available by the CDC is located in the Resources tab in this presentation, or by clicking the link below. When splashes, spray, spatter, or droplets of blood or other potentially infectious materials may be generated, and eye, nose, or mouth contamination can be reasonably anticipated, masks and eye protection devices must be used. Eye protection may include goggles, glasses with side shields, or face shields. You must train to know what types of PPE is available in your organization. You must know where it's located and how to use it correctly. Knowing what type of PPE is available, its uses, and when it's the correct option or not the correct option may be the difference between an exposure incident occurring or not occurring. For those that are engaging in first aid or medical treatment of patients, the potential of contact with bloodborne pathogens is much higher than those who are not engaging in these activities. To prevent the use of bloodborne pathogens, universal precautions should be used any time you are making patient contact, and appropriate personal protective equipment must be used. If possible, encourage the patient to engage in their own care, such as when the patient is experiencing a minor cut and can apply pressure to the wound on their own. If self-care is not an option, you should avoid applying pressure without a barrier. Of importance for first responders is the possibility of patients purposefully trying to infect the responder. If a patient is agitated, you must have heightened awareness of the possibility of bloodborne pathogens and use additional PPE. For example, gowns, masks, and face protection can limit or prevent the spread of bloodborne pathogens if an agitated patient tries to spit in the responder's face. Additionally, if your organization's protocols allow the use of surgical masks or spit masks on aggressive patients, these may be options to help protect not only you, but your crew and any other people in the area. In the course of your job duties, exposure incidents may occur, and if they do, we must know how to react and what actions to take to minimize the risks of the transmission of bloodborne pathogens. An exposure incident is a specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of an employee's duties. If an exposure occurs and makes contact with skin, the exposed skin must be washed with antibacterial soap and running water, as discussed earlier. If contact with eyes or mucous membranes is made, then the area should be flushed with running water for at least 15 minutes. If clothing becomes contaminated, it should be removed and decontaminated according to your organization's policies and procedures. The underlying skin should then be washed thoroughly. After taking these incident decontamination steps, the report should be immediately reported to your supervisor so that further action can be taken. By taking immediate action when exposed to a possible contamination, you are reducing the chances of becoming infected. If you are infected, the immediate action allows you to know of the pathogen and will allow you to take steps to prevent additional transmission. Also, taking immediate action helps identify the source individual and may allow for the source's blood to be tested for bloodborne pathogens if consent is provided and state and local laws allow for the test. After an employee has been exposed to blood or OPIM, a medical evaluation and follow-up appointment must be made available to the employee in a reasonable time and place. The evaluation must be conducted by a licensed healthcare professional and should follow the U.S. Public Health Service's recommendations. During the appointment, the employee's blood sample will be taken so that an accredited laboratory can determine if infection has occurred. The employee has the option to deny testing for HIV. However, the blood samples will be saved for 90 days in the case that the employee decides to have their blood tested for HIV. Within 15 days of the appointment, the healthcare's professional written opinion must be rendered. The opinion must only include whether the HPV vaccination is recommended, whether the employee received the vaccination, the results of the evaluation, and any medical conditions that may occur due to the exposure incident. At this point, you should review your organization's exposure control plan and discuss it with your supervisor. You must have a thorough understanding of the plan so that if you are exposed, you can take the appropriate actions and make the proper notifications. As we come to the completion of this course, the student should now be able to define bloodborne pathogens, occupational exposure, and other potentially infectious materials. The student must understand who is covered by the bloodborne pathogen standard and understand the epidemiology and symptoms of common bloodborne diseases. The student should understand how bloodborne pathogens are transmitted, be able to recognize tasks that may involve bloodborne pathogens, and know how to take steps to prevent the transmission of any infections. Lastly, the employee must know what to do and what steps to take in the event of an exposure. If you have any questions regarding 29 CFR 1910.1030, OSHA's Bloodborne Pathogen Standard, please contact McNeil & Company's Risk Management Department at 1-800-822-3747, extension 176, by email at riskmanagement@mcneilandcompany.com, or by using the Chat Now icon located on the right side of the screen.